Okay, before I walk into the patient's room, I will review the patient's orders. I will don the proper PPE of a gown and mask. I will then knock on the patient's door, provide them with privacy, wash my hands for 20 seconds per CDC guidelines, and then I will verify the patient with their name and date of birth on their wristband. And I assess the patient for their allergies. Patient states that they have no allergies and no allergies to iodine, latex, seafood, or shellfish. Patient is awake, alert, and oriented times 4. Patient states that they have no pain today, and pain is on a scale of 0. It's from 0 to 10, 0. And patient has no nausea or vomiting today as well. And the patient understands the reason for the tracheostomy care today to avoid infections from the secretions. And I will go ahead and start by positioning the patient into a high Fowler's position. And then I will go ahead and grab my stethoscope and go ahead and listen for any crackles or adventitious lung sounds, starting with the 8 posterior lung sounds in the back, avoiding bony promises for 30 seconds to get the best reading. And then I will go ahead and into the anterior section. I will then go ahead and assess the 6 lung sounds, and everything is okay. All right, and so now I will go ahead and start. And patient's vital signs, blood pressures, and everything is normal. I will go ahead and start with the materials. I will first start by opening the flap away from me, pinching the drape on the 1-inch margin, and placing it onto a sterile station. I will then grab the sterile solution and verify that it is a sterile solution and that the expiration date is within date, and then I will go ahead and uncap it, pour it onto the 2 chambers of the basin, and then I will recap it and move that away from the basin. And I will then now go ahead and wash my hands, and then I'm going to don sterile gloves in a non-sterile field. Okay. All right. And then I will walk back over to the sterile station. Perfect. And so now I will start by removing the materials from the basin onto the sterile drape, grabbing the pipe applicator, placing it there. I have the brush as well. I have the 2 Q-tips that I will then go ahead and dip into the sterile saline and then place it onto the sterile drape. And then I have the ties. The sterile field. And then I will go ahead and place them on the side here. And then I have the fenestrated gauze. And then I have 2 gauze pads. And I will go ahead and place them there. And then I have the 2 other gauze pads that I will go ahead and soak it into the sterile saline solution. And then I will go ahead and soak that and then place that on the sterile station field drape. And so now I will first start by, with my non-dominant hand, I will remove the patient's cannula from the tracheostomy. And then I will bring it over the basin on the first chamber, and then I will dip it into the first chamber with the sterile saline. And with my dominant hand, I will grab the brush. I will then go ahead and over the basin, clean that, and then I will remove the brush into the trash, and then I will then, with the cannula, pour it into the second chamber. And then I will grab the pipe applicator, pour that over the basin, clean that, dry it, throw this into the trash. And then now what I'm going to do is insert the cannula back into the patient's tracheostomy. Okay, and my hand will remain in place there. Now the next step, that with my dominant hand, I will go ahead and clean around the stoma. First, starting with the first Q-tip that's wet in sterile saline, sterile solution. I will go ahead and bring that over and do a happy face under the stoma. Dispose it into the bin. Then I will go ahead and grab a wet cloth. The Q-tip. I will grab the Q-tip. The battery. I will grab the next Q-tip, and then I will go over. Dispose of that. Then I will grab the wet gauze. One of them. Okay. And I will do a happy face under the stoma. Dispose of that. Get the next wet one. Go over it. Dispose of that. And then I will get a dry gauze pad. Go under it with a happy face. Dispose of this. Then grab the second one. Go over it. Dispose of it. And then my next step is to grab the fenestrated gauze. Go around. And then I will go ahead and keep that under the stoma in place right there. And then my next step is to grab the tie. Make sure that it's an easy tie and that I can fit 1 to 2 inches, 1 to 2 fingers of space in between. And once the new one is secured, I will go ahead and release the old one. And then I will just go ahead and, at this point, remove all my items and then dispose my sterile gloves. Okay, and then I will wash my hands, don new gloves, and then assess the patient again for lung sounds. 8 in the back. And then 6 in the front. And then everything is fine. I will go ahead and then go ahead and let the patient know that the procedure is complete, and that if they feel any discomfort or any nauseousness or vomiting, to quickly call the call light. That I will be right outside, and then I will go ahead and document my findings. I will document the secretions, any findings, any abnormalities when I assess the patient, their lung sounds as well, and that's it.